Hey, I'm Dr. Rick Barrett. I work on cancer immunotherapy here at Penn. And what cancer immunotherapy is kind of an overarching term that describes a lot of different therapies that take advantage of the patient's immune system to help them fight off the cancer. And one of the coolest, in my opinion, was developed here at Penn called CAR T therapy. And what this does is if you're having an issue with the patient's immune system recognizing the cancer, right, if the immune system's getting in there, immune cells are just kind of bumping off, not recognizing it, not activating, not killing it, what we can do is take some of those immune cells out, we can genetically engineer them to express a new receptor that we made that we know will recognize the cancer. We put those back in the patient, and when that immune cell hits the cancer, it sticks, it activates, and it kills the cancer. And it's just amazing that we can even do this, but what's even more amazing is the fact that it's actually working remarkably well and is being used in a lot of different cancer patients as we speak. So for anyone who wants to know a bit more in depth on how we create these CAR T therapies, I'll show you on my sash here. So we've isolated the immune cells. What we're looking for now are our T cells, because this is some of your body's best cancer fighters. And we need to get this special receptor that we designed into the T cells. And so the way we do that is we've designed this custom gene, put it into the T cells, and they'll start expressing the gene to make that receptor. Now the coolest thing about this receptor is it's kind of modular, right? And so there's different parts to it. The outside part we can switch out for different targets. The inside part is usually pretty similar between a lot of the therapies, and that has everything needed to activate these T cells and put them in killing mode. Now, the part that takes a little bit of creativity is in making this gene here. So lucky for us, decades of hard work have already been done to create the DNA that we can put in that codes for this receptor. But let's say we have a new cancer that now expresses protein Z, and we want to target that protein Z to kill the cancer. Well, we need to switch out the outside of that receptor so that it recognizes this new protein. And the way we do that is with antibodies, right? And so we'll have an antibody that's specific to this protein Z, and we'll find the cell that's making it, go into its DNA, pluck out the bit that codes for that antibody, and then stick it in with the rest of our DNA construct. And now that switches out the outside part, and that outside part should look just like our antibody, and that should guide these guys towards our target. And so in a way, this whole technique allows us to turn antibodies into receptors that can guide living cells and help them do their job.